Hello? Hello?
Hello.
Hi, doctor. How are you?
I'm good. How are you?
Good, good, good. This is Mickey. Thank you for coming, and appreciate that you accept our invitation.
Sure. Nice to meet you.
Nice to meet you too. Some 3 more minutes, but our
Sure.
community time is like, what do you call it? I don't want to call it who's another people, but it's an African call it Sudanese time.
That's okay. I know. That's okay. I came a few minutes early, so
Yeah, I was trying to all those time come earlier, and I drove all the way from Winnipeg to back to the community here. I'm in Lake San Martin First Nation.
Oh, okay. Yeah, the roads are bad today.
It wasn't bad. It's just windy, and snow is blowing into the road too. We can see, but it's fine. It's okay. Yeah, still, it's not as slippery, but I believe it's gonna be. It's cold outside. It's -16.
Yes.
Nothing would be bad. Yeah.
Yeah.
I had a roommate. Sometimes he drove in morning time. I don't like that. Morning time, early morning. I mean that 5 o'clock in the morning to get here by 9. And,
Oh, okay. How far is that? How far a drive is it?
It is 3 and 15 minutes. 3 hours and 15 minutes.
Wow.
Yeah.
Do you commute every day?
No. I come every weekend. Sometimes I skip weekend.
Oh, okay.
Yeah. To see the family in Winnipeg.
Yeah.
So do you want us to proceed with the vaccine and let this question rise up, or you want to?
Yeah. So I have a short presentation. If I could share my screen once the time comes, then I'll do that presentation first and then open it up to question. Then you can moderate the questions and.
Okay, I open that. I open the participant to share the.
Sure.
Yeah. Okay. Let me see. Who's not here? Okay, 2 minutes. I'm laughing like 2 minutes. They're gonna come in 2 minutes.
Well, we'll give them some time.
Yeah.
Hi.
Hi.
Yes. How are you?
Good. Hi, Dr. Oliver. Nice to see both of you.
Hi, nice to see
Nice
you.
to meet you too. Okay.
So Meki, am I pronouncing your name? Is it Meki?
Mickey, yeah.
Meki? Do you feel like there's lots of interest from your WhatsApp?
I'm doing now a message back. Okay. Telling them that it's a start.
Yeah, and lots of times whenever we've had meetings like this, folks come later too, right?
Yeah.
So
No, I just told the doctor that our community time is forget about it.
Yeah, there's like every time that I'm organizing any meetings, I'm always we'll give 10 minutes to start.
Yeah, that's the same here. Yeah.
Yeah, they don't respect that time. I don't know why. What's the problem? But they respect it as a job when they get paid.
That's funny. Dr. Oliver, how long have you been at Bridgecare Clinic?
Yeah, I've been since it started almost 10 years ago.
That's wild. So I used to work as the community health worker at Access Downtown, and I can't remember the first girl who was the Kendra. So when Kendra went on vacation, I think I had filled in like one time at the office, but I can't remember. There was 3 of us. So Kendra was there. I was at primary care clinic, and then there was the other woman who was upstairs at the day
the elderly. I know which one. Yeah, actually, I was wondering which organization you work with, because with Bridgecare, we haven't really partnered with you guys, and the team actually was wondering if you wanted to meet with us, like one of our meeting, come and say hello and see what you guys do.
Could you please? That would be amazing. I work at Immigration Partnership Winnipeg, and I'd love to come. And I think there's a lot of spaces for us to like connect. You have my email now, so
I'll email you, and because we'll always love to partner with different groups. And I vaguely remember you from Kendra's time, I think. I met you maybe once.
I was much younger.
We're all very younger.
He's still younger. So.
Thanks. I think that's a compliment.
So, Jessica, you have something in that microwave to eat?
Yeah, I know. It's so. I live in a small 1-bedroom apartment, and the only space that I have that's good for my computer is my kitchen. So like, now you're gonna see my olive oils.
That's good. That's good. That's good. Yeah.
I wish I was fancy and could like figure out how to do the foggy backgrounds so people didn't see my kitchen.
No, that's boring.
It's all like, it's very funny because right here is a big mess. Like it's very clean here, but right beside it is a big mess.
Time now is 6:01, and seeing about 8 people attending. Welcome everybody. And do we wait another 5 minutes, or are you just gonna proceed?
We can wait. I'm okay waiting.
The time is your time. It's my time, not my time.
We can wait until maybe 5 after and start.
Both of you ladies are busy. You have another job to do. You had your clinic, and she had also her program with the immigration office. Okay. And I'll let you introduce yourself. Yeah. Okay. Seeing welcome. Indisar, Islam, and see Samah, see Dr. Izzuddin. Okay. Welcome everybody. Let's give it another 5 minutes and then we'll start. I screen share for everybody, and for you, doctor, and for you, Jessica. When you have your turn, you can just share whatever you want. Okay. Okay, I put the notes in all the WhatsApp groups that we started, and I believe now it is 6:04, 6:05. Should we start?
Yeah, it says my name.
Okay. Good evening, everybody. My name is Mickey, so some people may not know my name or it's on the screen. Would like to welcome our guests today. We have our speaker, Dr. I'm not sure if I'm going to pronounce it right, but Dr. Assaneh.
Assaneh.
Assaneh. Assaneh Oliver, and she is a medical doctor at Bridgecare in Winnipeg. And also we have Jessica Prazink, and she is a project manager with Immigration Partnership Winnipeg. Welcome both. I'll give you the chance to Dr. Assaneh to start. Our topic is about the COVID-19 vaccine, and it will carry all the issue around that. Thank you.
Great. Should I start? Can you hear me okay?
Yep.
Great. So wonderful to be here. Thank you, Meki and Jessica, for organizing this, and nice to have everyone here. So I have a very short presentation, or kind of a short presentation about the COVID-19 vaccine, some of the main issues. I should say I'm a doctor, a family doctor, that I work at Bridgecare Clinic, and that's where we see refugees who come to Winnipeg. So this presentation I've been giving to a lot of different organizations. I'm going to start with that, and then after that we'll just open, and I think Jessica might have some things to say, and then we have a question period that you're welcome to ask any question. So I'm going to share my screen so I can start the Okay, can everyone see okay?
Yeah.
Great.
Yeah, it's clear, yeah.
Okay, so just a few, what is the objectives of this short presentation? Talk about benefits of getting vaccinated for COVID-19, possible side effects of COVID-19 vaccines, how to get COVID-19 vaccine in Manitoba, and life after you get your COVID-19 vaccination, and then we'll have a question period. And if I could ask everyone to mute yourself, please, that would be great. Thank you.
We didn't even know we'd be talking about. One, Dean Evans, because he replaced Jeremiah Mazzoli, and then in the West.
Okay,
Meki, you can
will you please mute your microphone? Well,
and then you see this. I mean, if you're
Mickey, if you can make me a co-host, I can help mute people. So if you hover over my name and there's 3 dots, you can make me a co-host, and then I can help mute if needed.
Okay, where are you? I'm looking for where are you?
You want me to stop sharing? Maybe you want to do that.
This dot.
Yeah, if you hover over my face, there's 3 dots, and then it says make co-host.
You're in now.
Okay, perfect. Okay, perfect. Okay, Dr. Oliver, back to you.
Sorry, okay, let's do that again. Great. Okay, so hear me okay? Can you guys hear me?
Yeah, it's clear, yeah.
Great, okay. Okay, so what are the benefits of getting a COVID-19 vaccine? COVID-19 vaccine is the most effective way to protect yourself from getting COVID-19 infection. The vaccine is an important part of stopping the spread of the virus to our families and communities, in addition to wearing masks, washing hands, and staying at least 2 meters away from others. And COVID-19 vaccine will help us all to return to a normal life. So basically 3 good things you're doing by getting vaccinated. You're helping yourself, you're helping your families and your communities, and you're helping the whole world to get to what was normal before this pandemic. So is the vaccine safe? And the answer is yes. COVID-19 vaccines have been extensively studied in diverse populations and are considered safe and highly effective, especially the ones which are used in Canada. There are only a few of them, and they're very, they've been shown to be both safe and effective. Will COVID-19 vaccines protect against the COVID-19 variants? I think that's a hot new question now, past few days. So the answer for Delta and those other variants before Delta is yes. COVID-19 vaccines provide protection against Delta variant, which is the main variant in Canada right now. Now, there is a new variant called, probably you heard in the news, Omicron variant. Studies are being done on this new strain. However, this is not the main variant in Canada yet. So vaccine does, help with Delta, and that's the main variant in Canada right now. And further on, even with this new variant, vaccines should provide some protection from severe disease and hospitalization in all of the new variants. I also wrote two other points in bold, and that is, one is the recent emergence of Omicron further emphasizes the importance of vaccination and boosters. So these variants are formed because people are not vaccinated. So if we all vaccinate, then there will be less of these, different variants. And vaccines remain the best public health measure to protect people from COVID-19 and to slow transmission and reduce the likelihood of new variants emerging. So you might, even if you're worried about this new strain, it doesn't matter. It is important to get your vaccine still. Can a COVID-19 vaccine make me sick with COVID-19? And the answer is no. None of the authorized and recommended COVID-19 vaccines contain the live virus that causes COVID-19 infection. This means that the COVID-19 vaccine cannot make you sick with COVID-19 infection. After getting a COVID-19 vaccine, will I test positive for COVID-19 on a viral test? And the answer is no. None of the approved and recommended vaccines can cause you to test positive on a viral test. So it does not do that. Is it safe for me to get a COVID-19 vaccine if I'm pregnant or would like to have a baby one day? And the answer is yes. There is currently no evidence that COVID-19 vaccination causes any problems with pregnancy. In addition, there is no evidence that fertility problems are a side effect of any type of vaccine, including COVID-19 vaccines. Is it safe for me to get a COVID-19 vaccine if I'm breastfeeding? And the answer is yes. There is no problem with getting COVID-19 vaccine if you're breastfeeding. COVID-19 vaccine does not hurt your baby. If I have already had COVID-19 and recovered, do I still need to get vaccinated with a COVID-19 vaccine? And the answer is yes. You should be vaccinated regardless of whether you had COVID-19 infection or not. That's because experts do not yet know how long you're protected from getting sick after recovering from COVID-19 infection. And the studies show that you only have protection for about 3 months. And after that, you can again get the infection. What are some of the common side effects of the vaccine? In general, the side effects observed during the large scientific studies are similar to what you might experience with other vaccines, like the flu vaccine. They include things like shoulder or arm pain on the site of injection, redness at the site of injection, body and muscle pains, chills, feeling tired, feeling feverish. And these are common side effects of vaccines and do not pose a risk to your health. It's a sign of your immune system working, and they all go away in 1 or 2 days. Are there long-term effects? And the answer is likely no. Like all new vaccines, scientists are studying COVID-19 vaccines carefully for side effects now, and they will continue to study them for many years in the future. However, there are no known long-term effects from any other vaccines that we are using. So how to access the vaccine in Winnipeg? I think Jessica will have more information on that, but basically you can help your friends, older relatives, clients to make an appointment. You can help them to fill their consent form and go to their appointment. So right now, all individuals 5 years and older are eligible for the vaccine. Recently, the vaccine was approved in children above 5 and above. And studies have shown that the vaccine is safe and effective in this age group. There is a website, I have this here, we'll put it in the chat, and you can just put your address on there and it tells you where you can get the vaccine close to your house. You can go as to many pharmacies, doctor offices, even as walk-in, some you don't need an appointment. So the vaccine card, you can apply for it 2 weeks after your second dose. And again, this is the website, you have to apply, and then you can print your, immediately your, you get the scan, you can scan, and then they also send you a card later on. At third doses, there might be some questions. So right now, all adults age 18 or older can receive a third dose of COVID-19 vaccine. For most people, the third dose must be given a minimum of 6 months after their second dose, except in very limited circumstances. The third doses are also available at any location that offer the COVID-19 vaccines. The province recommends a third dose for adults who are at increased risk of serious illnesses, like if you have underlying medical problem, or if you are a caregiver to a close and household contacts who have medical problems, all healthcare workers and pregnant women. But anyone can get the third dose. So, if it's been 6 months after your second dose, you're welcome to get a third dose now. Also, third dose are recommended for people who've only had a viral vector vaccine. I don't know if you remember, AstraZeneca was available initially, or Janssen. So you can get a third dose of a newer Pfizer vaccine. Also, if you had 1 or 2 doses of COVID-19 vaccines that is not approved by Health Canada, you can get a third dose of Pfizer vaccine. So as in Canada, in Winnipeg, an mRNA vaccine, Pfizer or Moderna, are used for all third doses right now. So is there a cost for COVID-19 vaccine? No, its vaccine is free for all people living in Manitoba, regardless of their citizenship. You do not need a Manitoba health card. They will ask you for it, but you can just give them any ID card. You can be a visitor. Anyone can get a vaccine in Manitoba. So what happens after you had your vaccine? So after your first dose, of course, you can still get COVID-19 infection. You don't have a lot of protection with just 1 dose. It's minimal. After your second dose, it takes about 2 weeks to produce full immunity. And the full immunity is about 80 to 90%. So there is still risk of getting infected, especially with the new variants. So vaccines are not 100%. So even if you have the vaccine, you must continue to follow all public health advice on wearing masks, indoor, physical distancing, limiting socializing, reducing travel as much as you can. So some of the main points, we said all the COVID-19 vaccines available in Winnipeg in Canada are safe. If you haven't already get immunized, please get immunized as soon as you can and encourage others to do. If it's been 6 months since your second dose, so you can go for your third dose to get a booster. And you have to continue to practice public health advice. You have to still wear masks indoors, social distancing, avoiding large gatherings, especially if people there are not vaccinated, and be still very cautious. So that's all I have as far as coverage. So Jessica, do you want to do your first and then open to questions?
Yeah, maybe we'll do that. I'm going to cover a lot of some of the things that you've already covered, and but sometimes repeating stuff might be okay. But I'll go a little bit more into depth about some of the like the immunization cards and the some resources and supports while you're getting the vaccine. So I'm going to try to share my screen, but it's always funny because I have some notes. Just give me 1 second. That I want to be able to read on my screen, but we'll see if this works. Just give me 1 second. Okay, let's see if I can do this. Sorry, everyone. If not, I might just be able to go off the, okay. Okay, so everybody can see my presentation, the slide, right? Okay, I don't know if I can see my notes, but we'll see.
It is on.
Okay, I have like notes wrote on the PowerPoint, but I won't be able to read them. But we'll see if I can do this off the cuff. Okay, perfect. Okay, so as Dr. Oliver said, there are there's more than 3 vaccines approved, but these are like the types, I guess, of vaccines that are approved in Canada right now. So the most common one you probably have all heard of is mRNA vaccine, and that's the Moderna and the Pfizer. And those are the ones that, for the most part, the government has promoting for folks to get. There also is the AstraZeneca, and many of you have probably heard about the AstraZeneca vaccine. The government's not promoting people to get this vaccine at this time. However, lots of people got it for their first dose. So if they did, they have some available if people want to get it, but they're still suggesting that people get the Moderna or the Pfizer vaccine. And then the Janssen one, so lots of you probably have heard of this as the Johnson & Johnson vaccine. It's a 1 dose rather than a 2 dose vaccine. And this one, the government's still promoting that people get the mRNA vaccine. However, it's a different type of vaccine. It's a, Dr. Oliver, can you help me out? What's the type of vaccine that it is? It's a,
I think it's also a viral particle.
Yeah.
So similar to AstraZeneca kind of, but yeah, it doesn't have it's not a mRNA.
Yeah, and so some people they can have some allergies to the stuff that's in mRNA, so they may choose to go with the Johnson & Johnson vaccine. So that's why it's been, I think it only just got approved in Canada maybe a couple weeks ago. But these are the major types of vaccines approved in Canada. So again, I'm kind of repeating what Dr. Oliver said, but I'm sure you all heard the announcement that anybody 5 years and up can now get the vaccine. So if you are wanting to book appointments for your kids, it's the same thing that you would do for yourself. So they can go to a walk-in or they can call the vaccine line. I'll throw in the chat after my presentation, so you can just call and book an appointment, or you can book an appointment online. So for anybody that's from 5 to 18 or 17, they're only eligible for the Pfizer vaccine, but anybody older than 18 and older can get Moderna or the other types of vaccines. And I won't go into the details about the third vaccine because Dr. Oliver did that, but folks can now get that third dose vaccine. And I really want to reinforce that vaccines are free. So you'll never get charged to get one of these COVID vaccines, and it doesn't matter your immigration status, just like Dr. Oliver said. So if there's anybody in your community that's a permanent resident, temporary resident, or they're undocumented, they can still get their vaccine. And you don't need a Manitoba health card to get a vaccine. So if you go to a clinic to get your vaccine and they ask you for your health card, you can say, like, you just say don't have it, and they can't refuse you to get the vaccine. So just keep that in mind. And so it's not a requirement to have your Manitoba health card to get your vaccine. You will have to provide some, it depends on where you go. They may ask for another form of identification to show that you live here. But yeah, that can even be, depending on where you go, that could be your driver's license. That could also be like a bill that has your address on it.
Sorry, or a passport.
Yes, or your passport. Yes, exactly. So there's different places that you can get the vaccine. So I'm sure you've heard that lots of people went to the RBC Center or that soccer space at Seven Oaks in Seven Oaks. So those are called super sites. So folks can book in at the super sites through the vaccine phone number, or they can go online and book through there. Also, there's pop-up clinics. So sometimes maybe you've seen them at religious institutions or community centers. I'm pretty sure the Sudanese Community Center downtown even held a vaccine clinic, right, Becky? I think you guys had one there, right?
Actually, you mix up. That's Southern Sudanese Community.
Oh, that's the South. Okay. So do you guys have a community space?
No, not yet.
Okay. So, so for the South Sudanese community, they actually held a vaccine clinic at their center. So those are called pop-up clinics. Sometimes there's been ones at malls. Been ones I think at like a football game. So they kind of pop up anywhere. Also, you can get the vaccine at a medical clinic or a pharmacy. So yeah, on the bottom, that phone number is where you can call to book an appointment. Or you can go online and book your appointment there. But there are lots of places that take walk-in clinics, so you don't even have to have that appointment. And right now, a really neat thing is anywhere that you can get your COVID vaccine shot, you can also get a flu shot. So if you haven't got your flu shot, you haven't got your COVID vaccine shot, you can go and get them both in one day, which is kind of nice. So, and just some other things to know about getting your appointments, and is that if you call that vaccine number, I'm just going to go quickly back, this 1-844-626-8222, you can actually request an interpreter. So there'll be a couple questions at the beginning of the phone call, and you can ask them for an interpreter in your own language, and they'll get somebody on the line to go through booking an appointment with you. And you can actually request an interpreter to go to your appointment. So that's also helpful to know for if you're helping your community members get booking appointments, is that there's interpretation services for free that's available for those appointments. And those interpretation services can be really helpful because the consent forms that are very wordy, the interpreter can help explain the consent form in your own language. Also, there are, for folks that, older folks, as well as people that have mobility issues, so like if it's difficult for them to walk, there's actually transportation services through calling 211 to help folks get to their appointments. So this is a free service. So if you know anybody who is a senior or has trouble with walking, they can use this service to help get to an appointment. And then finally, if you're trying to look for where to get vaccines near you, I think Dr. Oliver had mentioned this already, you can just go on the Government of Manitoba's website, and the link is here, and you can look for a place to get the vaccine. And what I'll do too is, Meki, I'll send you this PowerPoint, and then you can share it however is possible, so everybody can get the resources.
Thank you very much.
No problem. Okay, so now, again, sorry, Dr. Oliver, stealing all the stuff you've already shared, but I just wanted to like re-emphasize about immunization cards. So once you get that second dose, like Dr. Oliver said, after 2 weeks, you're eligible to get your immunization card. And so I think lots of you have seen it. It almost looks like a credit card that has this QR code on it. So also you just need the QR code. So they also send you an email with that code, and you can actually just print it off. So you can start using your QR code before the physical one comes in the mail, which is kind of good to know, or great to know, I guess. However, if you're wanting to request your QR code or your immunization card online, you're going to need a health card if you're going to request it online. However, sorry, I shouldn't say that. So you can still get your immunization card if you don't have a Manitoba health card. The only thing is that when you're going online, they're going to ask for your personal health information number. So that's called a FIN. It's like a 9-digit number. Dr. Oliver, it's probably longer than 9 digits. I can't remember however long your FIN number is. So you would pull that from your health card. But if you don't have a health card, you just call this number, the 1844 number, and you ask for a client ID. And so they'll check to make sure that you got your 2 doses, and then they'll give you a client ID number, and then you use that number to request your immunization card. So anybody who's gotten their shots in Manitoba can get their immunization card. And if you actually got one or both of your immunizations, so your shots outside of Manitoba, what you have to do is update, it's called an immunization record. So you have to go online here. It's a different form. You have to show proof of where you got your other immunizations. So let's say you were in Toronto and you got your immunizations in Toronto. You would go onto this website here that says forms.gov, and you would just show, you need to update your immunization record. So you would show some kind of proof of the type of vaccine that you got, the date you got it, and it would have to have some identifying information. So it's like your birth date and your name. And then you update that record. It takes about 2 weeks to update your immunization record in the government system. And then once you have that information updated in the government system, you can then get your immunization card with that QR code. It's a little bit tricky, I know, because like the immunization card, the health card, the immunization record, it all kind of sounds the same. But what I've done in this PowerPoint is given a step-by-step guide of the links you need and what is the required information. So when I send out the PowerPoint to Meki, you'll have that information of how to do those steps. And just a final thing about showing proof that you have your immunizations is that now Canada, the government of Canada has a proof of, they have their own QR code. So it's good to get both of these. So once you get your immunizations, you should have the provincial one, but also the government of Canada one, because if you're going to travel internationally, so if you're going to leave Canada, you're going to need the Canadian government one, because other countries will recognize that QR code and that proof of vaccine. And interesting enough, this is pretty easy. The government of Manitoba's website, where you get your Manitoba immunization cards, is the exact same place that you can request your government of Canada card, or not card, sorry. It just comes as like it comes as a QR code to your email. So hopefully that helps a little bit. I know there's like a lot of hoops to jump through to get these things. So if anybody does have questions, I'm going to put my email in the chat box. So you can just email me and I can talk you through it. Okay, and then I think I just have one last slide. No, I have 2 last slides. So if you're having trouble getting immunization cards, I'm going to put my email in the chat so you can email me. But also, Northwest Community Center also has supports for people to get their immunization cards. So you can just email them and they'll help you. The Mama Way Center also has, people can drop in there and get help getting their immunization cards. Or Dr. Oliver, I always put Bridgecare Clinic on here, but they have a staff. If you have any community members that use Bridgecare Clinic, they have a staff that supports their clients to get, or their patients to get the immunization card. And then just a last final thing, again, I'm going to share this with you, so hopefully it's helpful, but there are multiple sources of resources and information about the vaccine that you can go to learn more, or if you hear like a myth about the vaccine and you want to figure out if it's true or not, or you have a question about the vaccine and you want to figure out if it's true or not, lots of these different links have information about your questions. Also, the Ethnocultural Council of Manitoba, that's ECCM, they've made promotional videos for folks to get the vaccine, but in multiple languages. So if you ever want to show those videos with your communities, you are welcome to do so. So I know that lots of this information is more like links and stuff. So again, I'll share that PowerPoint with Meki and he can distribute it. And then I'll just put I'll put my email in the chat box as well. But that's it for my presentation, but super happy to answer any questions. But I'll be honest, Dr. Oliver has way more information than I do. So I'll probably just let Dr. Oliver answer questions. Thank you, everyone.
Thank you very much, Jessica. Thank you very much, Dr. Assaneh. And I'll open the question mark for the floor. If you have a question, I believe there is the 3 dot on your box. You can go and do 3 dots right there. And I believe hands raised. What is that hand? Raise hand. Okay.
I just raised my hand. I can't find it.
Okay, go ahead. Go ahead.
My question is to Dr. Oliver. You know, we always hear motivation. How this is going to continue? Are you going to be asked, you know, or I don't want to say forced, are you going to be asked or required to vaccine?
Hassan, I believe your mic is not. I can't hear you what they said.
Oh, you can't hear me? So
yeah.
Like, are we going to continue having vaccination like every year, every 2 years? Is like continuing. It's not. It seems like there's no queue.
Thank you for that question. I had a hard time hearing too, but I think your question is do we have to keep getting this vaccine in the future or not? Well, it's a very good question. And to be honest, no one knows the answer because this is new science. This is, we are all learning. Scientists don't have the answers for everything until they do studies, they do scientific research. So, you know, it's hard to know. You know, there is the flu vaccine. Of course, we have to get that every year because there is different type of the virus. So we need that every year. So as far as, you know, so there is no cure really for flu. We are just vaccinating every year. So as far as COVID, you know, it's hard to know. It looks like the new variants, especially this recent one, looks like it's weaker maybe. It doesn't make you as sick. So, you know, does the vaccine gonna work for this one or do we need a new vaccine? I think they don't know. Sometimes it's very easy to change, a little change, changes in the vaccine. So it could, you know, help with the new one too. Sometimes they don't even have to make the changes and it still works. So, you know, I mean, those are good questions, but, you know, scientists don't know everything until they also do the research and, you know, hopefully we have more answers as time goes by. But I think one thing that is for sure clear, if we want to get rid of it, if we want to get rid of COVID, hopefully, the more of us are vaccinated now, then the virus has nowhere to mutate, there has nowhere to go. And I think that's also in other countries, like in some countries overseas, the vaccination rate is very low. Maybe they don't have the vaccine. So the virus is mutating, you know, but if everyone was like 90%, 100% vaccinated in the whole world, we could get rid of it. But you know, that might not be a reality because vaccine is not available everywhere. So, you know, sorry, keep learning.
Okay, I think Dr. Muhammad Abdul Hamid. You're mute. You're mute.
Sorry that I was late a little bit for to join for technical issues, but I understood what's the procedure it's about. So I have three questions only, which is always in my mind. The first question is regarding for people who have already got the COVID, and they say that is they can it is they cannot take the vaccine because they have high immunity. Is that true?
They have high
One,
what? Sorry, I didn't hear the last word.
high immunity.
Oh, okay, okay.
That have more protection than to take the virus because naturally they already get the COVID. And
So
the second
can I answer
question,
that one first?
okay,
Before I
okay,
forget.
okay.
Okay, so thank you for that question.
Okay.
So yeah, so the studies show that if you actually have the infection, the protection lasts for about 3 months. So after 3 months, majority of people can get the infection again. But the vaccine protection lasts a lot longer. Like we say now, up to 6 months, then you can get a booster. Some people might start losing protection. So yeah, really, the studies have shown that's not true. That if you get the infection, and we've had people at our clinic who've had the infection more than once. So yeah, it really doesn't give you a good protection from what the studies show.
Okay. The second question is about the vaccine itself. Some people who are vaccinated, but they will get the COVID again. So what is the use of that, to get vaccine and you get the COVID, whatever it is?
Yes. Yeah, that's it.
Okay.
I'll answer that. Yeah, that's a good question. So, from the beginning, we said the vaccine is not 100%. So, if even after the second dose, even 2 weeks after your second dose, 80 to 90%. So there is still that 10 to 20%. They don't build immunity. So of course they can get the infection. So if a large number of people are vaccinated, like we call it herd immunity, I think you might know what that is. So if a large number of people vaccinated, so those 10 to 20% are also protected because there is no more corona in the community. But if if the corona is going around, so it's going to find those 10 to 20% who had the vaccine, but they still get it because it's not 100%. Another reason is the variants have shown that the vaccine might not be as good for the new variants so there is more risk. Another thing, after 6 months, some people's immunity goes low, some don't. So then they're prone to get the infection. So yeah, so I mean, the vaccine is not 100% fixed. We are still wearing masks and careful, and we have vaccine. So I think and vaccine prevents serious disease. So it prevents hospital admission, it prevents death. So that's also important. So you might get a milder one. So for all those reasons, I think, getting vaccinated is a good idea, even if there's a small risk you might get COVID.
Okay, thank you. The third question, and it may be the last question. It looked like, by conclusion, come to my mind that it looked like the marketing competition with those companies who are producing vaccine. So this is say Moderna, this is Pfizer, and this is say that, this one is bad, you have to use, this one have side effect. So as Jessica said before, that is look like every 6 months you have to get the vaccine. So this looks like marketing issue connected with the health. So which one is the best vaccine one can carry? Which one is better overall, this one?
Yeah, good question. so for sure there is the pharmaceutical companies. I never trust those. So, but what we are listening to is Health Canada. Health Canada doesn't really have a marketing thing. I trust them. I trust that they look at the vaccine. Like there is a lot of COVID vaccine now across the world. There's some made in the Chinese, Russian, all these other vaccine. But I think Health Canada kind of gets the vaccine. They do they look at studies. They look at is it a good vaccine? Is it safe? They look at all that. They don't rush to, they're working faster. A lot of scientists are working much faster. And they're not kind of missing the steps and try to, more make money or something. I think Health Canada is looking at all these vaccines, and I trust they give us they tell us which one is good. If the pharmaceutical companies tell me which one is good, I don't trust them, because I know a lot of them, they want to have their profit, but we are not listening to them. We're listening to Health Canada. And right now they're saying the mRNA vaccines, which is only 2 of them. We have Pfizer and Moderna. They say their best vaccines give you best protection with a minimal side effect. So that's what we believe in Canada, and that's what we are using. They're both as good. We don't say one is better than other. At one point, government was getting more Moderna, then now we're getting more Pfizer. They're both as good. So I think right now, and science is changing as we see. And again, Health Canada might look at some other vaccines in future, and maybe there will be better vaccines. We don't know. I think it's something it's a learning thing. But right now, Pfizer and Moderna, I trust. And I don't trust the pharmaceuticals. I trust the scientists, that they seem to be, the ones that are the safest and most effective. So
can I have one more question? I can say, is that this vaccine, as you scientists, is that effect on the genetical issues especially for kids or something like that?
yes,
the genes
yeah,
we never know. That is
yeah. So that's a good concern. What these mRNA vaccines are actually, they're just a piece of kind of protein. So they don't they enter your cell, but they don't go to the center of your cells where the DNA is. They just stay outside and trigger your cell to make a protein. And then the body gets rid of them. They're out of your system in 2 days. So they don't even go where the DNA and your genes are. So they really don't affect your genes. So they're gone in a few days. They don't even stay in your system. That's the science. So so that's what they're safe. They're safe for kids. They don't affect their genes. They're not getting into the DNAs. I think there was, the only reason we haven't had these vaccines like this, because there's been no kind of, the scientists didn't work on them. They have been around for a long time, but because there was no urgency, they were just kind of sitting in the fridges and not being worked on. So now, once this happened, they actually worked on this type of vaccine. And in the future, we're going to see, I think, a lot more of these mRNA vaccines, because they're really safe and they don't affect your genes.
Any other question around there?
I can say one thing. What's the effect of the pills? Now they are issued like pills, carry the same kind of vaccine or protection. Is that effective? Or people can use the pills instead of vaccination, something like that.
Sorry, what do you mean pill for treatment of it?
Yeah, pill like they said there is new pills it's
Okay.
produced,
Yeah.
and that pills the people they take to get more protection about the COVID and something like that.
That's a medication for the COVID-19 infection. So people who are actually sick with COVID-19, they can take this medication that it's supposed to help with the infection, but it's not a vaccine. So the vaccine still, the best one is that injection to get prevented from getting the infection. Yeah.
Okay, thank you.
Any other one? I can see a hand up, but if you can put the hand up, please go ahead. Any question?
And then there is no bad question or wrong question. And this is like, we don't judge your questions. Like if you have any question, you can ask. Even you can write it anonymously in the chat box if you want.
Yeah, Sar?
Thank you. I would like to thank you, Dr. Oliver and Jessica, for providing us with this information. I'm just wondering about the new variant. What are the symptoms? And like, just is it like the same? The new variant?
Omicron.
The same symptoms or different? Omicron.
Yeah, so that people, again, they're studying on that one, but so far it's shown that the symptoms are similar and maybe even milder than the Delta variant, the one which was before that. But yeah, the symptoms seems to be similar. But it seems like this one can transmit better, faster, more people. Like it's easily transmissible compared to the other ones. But so far they seem like the symptoms are pretty similar. It's the same virus, I guess, with some mutation. So it's not like a new disease. It's kind of the same disease, same virus, but it's changed itself. And a lot of we don't know about it, but yeah, I think to answer your question, symptoms are similar and maybe milder.
Okay, thank you. Also, I have another question. Is this the new variant? It's transmitted through the animals? Because I just heard about they did test on a deer and it turned out it's positive. Is that true?
I think that's not for the new variant. I heard some things about that too, but it's I think that's like the studies have shown that now generally the COVID-19, there is some animal have had it too. It's not anything to do with the new variant in general. So they're studying it more. I think some of the animals in the zoo had shown that they might have, they probably got it from humans really. So I don't think we have to worry about animals giving it to us, but us giving it to animals more than anything.
It's a big concern. Yeah.
Yeah, so I mean, yeah, so I think there's been now more cases in animal that initially it was. So the virus is probably, able to infect them.
Yeah, thank you so much.
Sure.
Thank you, Sar. Abu Bakr. Abu Bakr Khalifa.
Sorry, it was not. Thank you so much for this. Like we learn more and we know everything about the COVID-19. Just I have a question, like maybe I couldn't find an answer before for this question. I took the three, like I took the three vaccine, and I'm doing dialysis. So like if they call me for transplant, I'm on the list. So what's the time like I can do the transplant after I took the vaccine? Like, because it should be there is a time, like, I don't know, months, 2 months, like, because this vaccine, like, if I do transplant, I'm gonna have medication, so it's gonna work against this vaccine, I think. So there is a time like I can do the transplant, like there is a certain time, like how many months after I took the vaccine?
Yeah, I think, for this specific case, you might have to ask your physician, probably whoever, to have more specific about your case. From what I understand, like, yeah, if you have a transplant, you have to be on a lot of medication which suppress your immunity, so the vaccine doesn't work as well. But if you've already got your third vaccine and you still haven't got your transplant, so that's good because your third vaccine is working now. So then it depends when you're going to have your transplant, if you're going to need another, like a fourth dose or not. I think you really have to wait and see when is your transplant compared to your last third dose, and then talk to your physician. And I think each case is different. They will probably help you, tell you exactly when it's a good time to get it. But since you've had your third one, that's good now, because you haven't had your transplant yet, so it's helping you now.
Thank you so much. Thank you.
Zadine, were you trying to have a question or a comment? No? Any other question?
Yeah, and I have. Just I want to to know that the virus which is said in South Africa, it is eliminated, it changed itself to another more. So we have the virus not only in South Africa. It can happen that it's not only in South, it just carries the name of South Africa, but it can be anywhere else. It's only the name. Because I see the map today, in the world map, most people in the world, they restricted the flights. So nobody's going, and some are cut out. Even the Canadians, they cut in South Africa somewhere. So as I understood, that virus will be coming seasonal. So after 6 months, you have to get, or especially in winter. So how I can figure out this is the flu or this is COVID? If someone come coughing, that maybe he have flu. He says that running nose, I said he's COVID, and these are very confusing things. I don't know how to figure that things in the future.
Yeah, so if COVID can be very similar to the flu right now. Like, you cannot differentiate them without a test for COVID, because some people have very mild, like runny nose, and at our clinic we tested many people just with runny nose and they had COVID. So the only way to differentiate is by testing right now. And you're right, in the future, it might even be more like, so and I agree, like, it's probably spread to many other countries by now. I think closing borders, everyone think is not very, I mean, it's already too late, I think. The new variant probably is already spread. I mean, the only thing that would be nice if people were vaccinated more in some of these other countries. So then these variants can't get a hold and spread to everywhere else. So, I mean, I think it's not just South Africa. It could be any other countries which are not vaccinated as much. I think the countries which vaccination rate is high the risk of having these variants coming in those, like starting in those countries is not very likely, because the virus is dampened. It can't mutate, you know, but if it's the virus is going in the many people, and now they think this new one has some genes from the regular flu, because maybe the person also had the influenza. So, you know, but if more people were vaccinated, that does not happen usually.
This is due to this question. I get the virus. I brought it to family from the workplace. So I get my elder son and my wife. They suffer like 5 days, but I was suffered too much. You know, like, but Health Canada couldn't help me. Said, hey, if something happen, call the ambulance. But I use natural herb that is from home, and that is what I insulated myself. But I got my youngest son. He's going to the daycare. I insulated him for 10 days and then take him for test. He's negative. I kept him. And then from other daycare, and now he's under, his school program. So one day they said, oh, they pick him up because he have running nose. I said, if you don't have virus, I took him from, from the school and when tested him, he is negative. Every time like that, he's negative. He never get among us. A youngest kid, you have the virus. You can't keep push him away. He will not go. But he never gets the virus. You know, this is make me confusion. That is why this one he's among us. We are with the virus, and even I suffer like 2 months to get well, and he never get anything. He's eating well.
That's good. Did you tell the school that you have the virus at home? That's maybe they get worried about it.
Yeah, but you know, we had some very large families, and you know, like sometimes not everyone tests positive, and you might miss also the window that they could have had the asymptomatic infection or so that has happened. We've had some families that some of them never test positive, but you know, they can still give it to other people even if they don't have it sometimes. So you have to be, you know, that's why.
But like this, I have to give him vaccine.
Yes.
It's always negative.
No, you should give him vaccine for sure.
That is why he made me.
Yeah, no, you want him to stay healthy, so you never know. I think, yeah, you should give him the vaccine.
Any other question around there? I may just have a comment, and if there is no question, and then I'll have a question to Jessica. Let me start with the question to Jessica first, and then I do my comment after. From your presentation, you talked about this, the vaccine now is available for 5 to.
That is the guy.
Hello.
He's just 5 years.
Yeah, so listen to this question too, because the vaccine now available from 5 years old to I believe 11 years old too. I tried to book an appointment for my daughter too. She's actually not 14 yet. She's close to 12 years old now. I mean 11 years and a half. So what happened now? If there is any news about this vaccine will be coming to school, instead of parents are going to call, book an appointment. So there is any news that this vaccine will arrive to the school with nursing and so on. Then they just give the kids with a consent form, of course, that being signed by parents saying, yes, give it my kid, give it not give it to.
Yeah, so and Dr. Oliver, you may have more recent news than what I have, but my understanding is that they are going to, if not already, start with doing immunizations in schools. It'll be the same thing as the other type of immunizations your children have gotten at schools. So it would be a consent form out to parents, and the parents would have to sign the consent form and agree to having their children vaccinated. But Dr. Oliver, have you heard of any confirmed immunization clinics in schools yet?
So public health told us they are going to in December. They're going to, but I haven't had any confirmation exactly if it's happened or not, but they are planning to do it.
Yeah.
So
in September, yeah, because I asked my daughter, she had some immunization dose of it, 4, I think, or 3 of them. That she missed them, and then the nurse called me and I booked the appointment. But when I asked her, she said not yet. The COVID one is not yet.
Okay. Okay.
But I think it's going to, because it was just approved. So I think they were just ready for the approval, and then they should do it.
Yeah.
They should.
Is that mandatory or option? Will be.
It'll be optional. So you as the parent will get the option to let your kid get the vaccine or not. It's important to also know that anybody 12 and older, as long as they do have a right to give their own consent if they want to get the vaccine. So it's called informed consent. So somebody who's 12, right? I think it's 12 and older. They can, if they can show that they understand what they're doing by getting the vaccine, they can actually choose to get the vaccine on their own. It's just called informed consent. But but schools will always send a letter home to you and asking for your consent as their parent, and then you get to choose if your kid gets the vaccine or not. But I know that the province was working with school divisions to come up with a plan to have immunizations come to schools. So it should be in the works, like Dr. Oliver is saying, and hopefully in December that'll come out. But that'll be a lot more convenient if you could just get your kid vaccinated through schools, just like they do with the other shots, or other immunizations. So hopefully this month. We're already the 5th of December. So yeah. And also something I should know with my email is that I know that sometimes people have going back to the immunization card or booking appointments. If you have any issues, like for some reason you're trying to get your immunization card and the system keeps telling you, oh, you didn't get the second dose, but you did. If you have any issues like that, send me an email, because I have some contacts at the province and I can call them and get them to hurry things along or find out what the barrier is. So again, just if you need any help like that, I'm happy to assist.
Thank you, Hiba. She made a comment that coming to my kids' school on December 8th. And that's the St. James area, which is called what that school division called? What is the name?
Is it St. James?
St. James Division, Assiniboine School.
Assiniboine, yeah, Assiniboine.
One question to Dr. Oliver, if possible. I have some friends who are working with the government, and they mandate that they have to get the vaccine. It's legal. If not, they will be fired. And they get the vaccine, but they get trouble. That is, they give wrong example to other people not to vaccinate, because they get in 5 days high fever and diarrhea, after the first dose, and they endure the second one after. So what's the result of that vaccine? If you are healthy and you take the vaccine, you get trouble. So you get bad, example to other people not to carry the vaccine.
So so the vaccine can have side effect, and as actually if you're younger and healthier, sometimes that side effect can be a little bit more. It's your immune system working. So it's usually about a couple of days. You can still take some Tylenol. It's a mild sickness. Usually it goes away. I mean, but they're helping their families. They're helping even if they think they don't need it because they're healthy. You know, they are sick for 1 or 2 days, and then they're helping everyone else to protect everyone else and themselves too. So, you know, because sometimes they can get the COVID itself can be very worse. So for sure, you know, I had a fever for 1 or 2 days. You know, it's very common. And if you're physically active, actually, you get more. So if you're healthier, actually, you have a higher kind of immune response, which is because your immune system is robust and it gets working. But again, it's pretty mild and it goes away. Like it's, you know, so no one is denying it might not give you those side effects. So, you know, I mean, it's a public health issue. That's why some places, you know, they want you to have it because it's not just, you know, it's a little bit like, you know, smoking indoors. I don't know if anyone remembers that, but for a long time, you could smoke indoors. You could smoke on the airplanes. People thought it was their freedom, but they were hurting other people. Like you know, secondhand smoking is killing other people too. So now we look at it and say, well, what were they thinking about? But I think, you know, like this is the same. It's for the common good, or even yeah, smoking or seatbelt. Like, you know, seatbelts were not compulsory, like I don't know, 10 years ago. But then, you know, it's good for. Yeah, so that's why I think that, you know, some places they make it, you know, and then some, yeah, I mean, there's a lot of, you know, discussion going on, but I think it's for common good. And I think that's, everyone wants to help other people. I think that, yeah, I think it's our world has come together from this pandemic more than ever. So I think it's you know, we're helping others, yeah.
Anyone have a question? Anyone?
I'm just wondering between the time between the two vaccination, is it like 3 months or 4 months?
Between your first and second dose, you mean?
Yes.
So and right now they say the best is 2 months, actually, 8 weeks.
And between the second and the third, like right now, I did the second. I'm not sure like how long. 6 months?
6 months. Yeah.
Okay. Thank you.
Sure.
Thank you, Sister Intisar. Any other questions? Any other? You can put your hand up, just open the microphone and ask if you have a technical issue like that. Any other?
Sadiq, I think.
I'll just give a question, but before I give a question, I left Canada in last April to Africa for a family reason, and that time the vaccine wasn't given to people yet. And on May, the vaccine arrived in Sudan, actually, which is arrived by the United Nations and the UNICEF, a group of organizations are bringing the AstraZeneca and the Chinese vaccine. So luckily, I get the AstraZeneca one, and it is acceptable in Canada. So when I came back, I had the 2 doses there. I booked my appointment for the 3rd dose, which is going to be in January. I asked my physician, and he said there is no problem. There is no problem that you have the AstraZeneca, and you're going to get this Pfizer, actually, the 3rd one. Beside that, I'm a science teacher. We will talk about MRR. Yeah, it's a messenger RNA from the virus being taken away, and that has to build some protein into the human body. Then the human body will get the antibodies, or whatever that process. We know it in the science. But now I look at the AstraZeneca one, which is not developed the way the Moderna and mRNA developed. Totally different developing from the 2 vaccine. So I'm considering myself taking a new dose from the scratch. My question A, why Canada stopped AstraZeneca, and which is still, there is no comment around the world about it. Muhammad mentioned that before, and I believe that part of the marketing plan, okay, and the competition between the company. Because when we stop here, I remember that it caused some heart attacks to some people, which is 1 out of million. And now it's still a stop, it's not being used yet. It is recommended by Health Canada, 1, 2, 3 vaccine, but actually there is 2, or we can Jonathan and then the advisor, or we call it 4, because he put them in the line in your presentation. AstraZeneca, do a dash or a line, not like not used, but it is recognized. There's any scientific fact that AstraZeneca stopped from being used in Canada, or we just put it the way Muhammad asked about it before?
Yeah, it's a good vaccine. Yeah, I think one of the other reasons this is just the issue of blood clot, and there is that risk of blood clots with AstraZeneca. They're pinpointed, I think, how it is done, but especially in younger females, remember that. So I think that risk of blood clots also frightened Canadians, I guess, the people, and that could be one reason too, that that's not being used as much in Canada now, because there is still the risk of blood clot with AstraZeneca, but there is no risk of blood clot with the mRNAs. So that's one reason.
The risk is how much is it? Is 1 out of a million.
It's low, the risk is low, but when it was happening, many people refused to get vaccinated altogether because it was headline of the media, and people were so afraid, and it really negatively affected the campaign for vaccination because of fear that it started.
Okay.
So I mean that's one thing. I guess also, Pfizer and Moderna, the pharmaceuticals are also closer to the physically, so maybe it's also easier to have the supplies coming to Canada as maybe AstraZeneca. I think it's in UK or India.
Yeah.
And the practicality, I think that could be that. Yeah, I mean, I think those are pretty good questions, but I don't know.
The price of, that's what I learned, the price of the dose of the AstraZeneca is costs about $5, and that's why the United Nations, the UNICEF, they are buying AstraZeneca and distribute it to the African and third world countries. Yeah. While the other one is 35, the dose is 35. So you get 7 doses with 1 dose.
Yeah.
Yeah, that's one of the things too. And then the propaganda behind the stopping that. So sorry.
Some other things about AstraZeneca, like I think that it's with Delta, it wasn't as good as coverage as the mRNA, like with some of the variants, it wasn't. I vaguely remember like the after for a while, like the immunity goes down. Like it's a good vaccine, but I think in comparison with mRNAs, or it has some low kind of points for it. But yeah.
Okay, thank you. Another here?
I have 2 questions. I'll mix it together. The first question is, what's the effect of if the mix of 2 vaccines? One get the AstraZeneca and then get the other one in the other dose. What's the side effect of that? The second question is look like 4 months ago. They have like in Toronto, Ontario, like 110,000 doses of the vaccine, which is expired. it is from manufacturer, it is expired date. But here they extended 1 month again. Is that right? If
So
it
for,
is expired, you going to extend it for 1 month to vaccinate people?
yeah. So for your first question, which I already forgot, sorry, what was the first one? I should ask you
The
guys.
first question concerned if I will.
Oh, mixing the vaccine, sorry.
Yeah, mixing the vaccine.
Yeah. So
Second-
yeah, there is really no side effect. Some studies actually said it was a good thing to do that because the immune system was boosting with different mechanism and had a better response. But basically, so yeah, it doesn't hurt you to get different vaccines. I think kind of the final thing was, well, if you get one, try to get the same one for the next one. But again, it's not harmful to get that. As far as the expiration, I don't know about this specific case. I know that the Pfizer, the pharmaceuticals are doing studies on the vaccines, and at first they said all of them have to be on minus, like God knows what, 90 or something, and then they did some studies and they said, well, okay, you can thaw them and keep them in the fridge for now they say for 2 months. And I think maybe initially they said 1 month, but then they extended to 2 months because the studies showed that it was okay. So it's possible that the new information is coming and that makes them to extend it, because otherwise, like, we are very strict about the vaccines are thrown away if they're expired. But it could be that the pharmaceuticals are changing because their studies come out and say, well, you can extend this for another month. Studies have shown it's fine. It doesn't hurt. It's still as good. So maybe that was the case. But yeah, I'm not exactly sure about that case.
People that took it that like Canada take it like economical issue for the price of the vaccine, not for the health of the people. That is what
No, I don't. Media. Like I trust Health Canada wouldn't do that. Like, I mean, I just really trust the government and the healthcare people on top. And I think they rather to waste the money than hurting people. So I think, yeah, they would not do that unless maybe the studies showed they could be extended. Then they did it. Yeah.
And one question more. That is the sign after the vaccination we would like to add volunteer or something like that to the vaccine.
Sorry.
So that volunteering, that is taking the vaccine and that you are vaccinated. So just volunteering, that is, there is no trust. Just you are just getting experiment. So that is people who see that, oh no, I don't want to be an experiment. So that is many people. I met many people. They say that. So that is how you set up their mind that is to go for vaccine or something like that.
Well, any science, any medicine, any vaccine, they need volunteers to do studies. Like, people have to volunteer, and they're not God. They don't know what's good or bad. They have to do studies. And so if people are volunteered to do these studies, but once the studies they know they're volunteers. But once the studies are done and the data is there, then it's approved, and we are not guinea pigs anymore. The initial batch they knew about it, but once it's approved and they did the study, it shows it's safe, then I think, then you should be confident that we're not guinea pigs. So then we're not,
Yeah, it's hard because other way that is religious, they are preaching people that no, don't get vaccine, don't what, I get, we are march to stand near legalization building that they need the freedom, they need the right, no vaccine, no. Group of people, but you can't convince them. So
Yeah.
It's hard. Right.
And I think, I don't know if there's any religious leaders among us, but they can really help because I have patients who say that they don't want to go against their religion. And I keep telling them, really, this is, they say they don't get a tattoo and they feel like this is a tattoo. But I tell them this is not tattoo. There's nothing foreign. It's not a blood product. So I think if religious leaders reinforce these things also is important because, yeah, you're right.
Any other question on the floor? I think we almost have about an hour and 25 minutes. Yes, I booked it for 2 hours, but I believe that there's too many people who are going to attend. And if there is no question, we're going to conclude this session. Any other question? Okay, look like there is no question. So I'll thank you, Jessica, for providing your email, and thank you. You're gonna send me the presentation. I'll put it into the WhatsApp for the the community groups WhatsApp, and then people can now download it and see it. I would like to thank Dr. Assaneh Oliver and for her participating in this Zoom session, which is the first session that our community, the Sudanese community in Manitoba, which is Sudanese Canadian community in Manitoba. And I'd like to say this is a beginning. We may invite you again in another session, regardless COVID or any other issues. Well, thank you very much. Thanks, Jessica, for helping that. And thanks, Jessica, also from the immigration. We may ask you to join us again in another issue, another topic, also could be in an immigration issue. I believe that that's issue, lots of Sudanese, they will come to it. We'd like to thank everybody for coming and hope you have a great night and great weekend and a great weekend day. Thank you.
Thank you, Mike.
Thank you.
Thank you so much.
Have a nice evening.
Thank you.
Bye.
Good night.
Bye.
Thank you. Bye.
Okay, okay. اوكي بكر الخليفة قاعد فكان نايم اظن بكر الخليفة عز الدين
نايم بتاع شنو يا اخي؟ انا من قبل متابع هنا.
عز الدين وين عز الدين نايم كل مرة يظهر لي في الشاشة عز الدين كنت قاعد اسال ولا عنده حاجة وينه؟ دكتور عز الدين
الدكتور يخط عليه يكون هنا فعلا اخذ له دكسه.
صادق قاعد شايف برضه صادق اظنه قام اسمه مشى عز الدين نفس الحكايه دي مرض عز الدين يكون مع عز الدين يكون بنت ولا هو يكون حاجه دي
ايوه احتمال اي لانه هسه طلع هسه
طلع الصادق
بس في اسلام والصادق
اسلام برضه نقصت نامت
اسامي في الهنا نامت يا اخي بيعملوا لها في اسنانها نامت ما تنوم في
لكن حضوركم يعني 16 ماكسيموم
ماكسيموم نص ال 16
هو 16 طلع منهم جيهان بيتحسن وطلع منهم شهاده بالتي وده يعني يا اخي والله دي كوميونتي عليه اللي ما تحيه والله
يا هناي انا شفتها من 5:15 رسلت في الخاص ل 600,000 نفر وبعدين يعني لما شفت الناس اللي قروا انا في المسج اللي رسلته هنا وهنا لقيت الناس دي كلها درسوا لكن ما دار يخشوا بس ما دار المره الجايه اقول لهم جايبين ترباس لا ترباس هنا دايرين نعمل هنا يا اخي دايرين نعمل اسمه شنو ده الاستغلال هسه نعمل له شنو يا مكي كده خلينا نرجع في الخاص يلا سلام خلاص كويس سلام خلاص خلي الناس النايمين ديل يكون
حيكون مقفول. يلا سلام.